Thank you so very much for attending this important session again tonight. My name is Melanie Robertson and I'm the Acting CEO at Ballarat Health Services. We, Ballarat Health Services, acknowledge the traditional custodians of the land and waters on which we meet. For me, that is the Wadawurrung people of the Kulin Nation, whose culture and customs have nurtured and continue to nurture this land since Dreamtime. We pay respects to elders past, present and emerging, and express our gratitude that we can all share this land today. We welcome all people here tonight from all cultures. This night is an information session for everyone in our community. We'll hear from speakers such as Associate Professor Rosemary Aldrich, the Medical Director of the Grampians Public Health Unit, about the current situational report in which Ballarat finds itself in and the local responses and the local response that is occurring. Hugh Varley joins us from Department of Health. He's the Manager of Rapid Response Engagement, and he'll talk about the current restrictions in place. We'll hear from our CEO from the City of Ballarat, Evan King, for a message for the community. And we'll also talk to Nikki Stiefel, Disability Liaison Officer, on disability supports and information available for the community. We certainly want to get, once again, some key messages across. Incredibly important that our community is well informed during this period of the pandemic. We certainly want people to get tested as soon as possible. If they have the slightest of symptoms, then urgent need to follow restrictions. No one can come to your home or visit at this time. We want people to wear masks everywhere if you leave the home, indoors and outdoors, to continually to check exposure sites and follow advice if you have visited an exposure site, and certainly get vaccinated if eligible. 5 key messages that will keep us extremely safe. And we continue to talk about we're delighted to be out of lockdown, but we're in a current situation where we have the potential for coronavirus or COVID to emerge at the slightest drop, and unwillingly into our community. We want to do everything we can to protect that. This is an opportunity, though, not just to hear from us on COVID-19 and the current impact to the Ballarat community. More importantly, we want to hear from you, and we want to answer your questions that you don't have the answers to. So this is your forum to ask, an incredible range of people that have incredible knowledge of COVID-19, but incredible knowledge of the Ballarat community, and to get those answers to your questions. And that's the most important thing. At Ballarat Health Services at the moment, our priority is providing not just incredible healthcare to our community, but providing the information that our community requires to keep safe. So once again, thank you very, very much. We asked you to follow through the Facebook chat and to put your questions there. We're delighted as well to have Auslan interpreters with us today, and certainly this will be recorded so that people have this information in the future. Once again, thank you so very much. And I'll welcome Associate Professor Rosemary Aldrich.
Thank you. Thank you very much, Mel, and good evening, everybody. So today in Ballarat, as you would have heard in the news, we've had 1 case of COVID reported, which brings us to a total of 19 active cases in Ballarat since the beginning of last week. So what we've seen in the last week is a tremendous response of all sectors in Ballarat who've come out and supported the need for us to stop something before it started, by not only standing up and getting tested and coming out to get tested, but also by abiding by our lockdown restrictions, which gave the Public Health Unit, Ballarat Health Services, and all we who were engaged in trying to solve this challenge of a potential outbreak beyond our capacity, gave us the time to really nail that down and to understand where things were moving, and to ensure that people who are at risk were in quarantine, so that as those people who have been exposed, potentially exposed, who are already in quarantine, sometimes they become positive, but when we know that happens, they haven't been out and about, and we know that there's very limited risk to the rest of the community with no additional exposure sites. So I'd like to say a very big thank you, of course, to the people of Ballarat with whom we spoke last Friday night, and certainly be, I think, congratulating ourselves at this stage at least for all the work we've put in for the last week. There's a couple of other things to talk about tonight, and they are that, as we mentioned last week, the process we go through is when we identify a case, we ensure the case has that care around them that they need. We ensure that we understand where they've been, if they've been out and about, and if they've checked in using their QR code, then we can source the information where they've been. We can then look at those particular locations where they've been and determine the nature of the risk around that. And we call that giving it a tier status as a tier 1 or a tier 2 site. And then, of course, we set about making contact with people, especially those people who are primary close contacts or household contacts or workmate contacts or social or care related contacts, but also those contacts that we've discovered who might be tier 1 contacts because we know about them because they have checked in where they've been, or indeed they might be members of staff who've worked with the person. So we find all that information and we then make sure that we communicate as quickly as we can with the people who need to know. And part of that is about putting exposure sites on the website, the Department of Health website. It's really important that as a community, we continue to monitor those exposure sites. Sometimes we do find that an exposure site comes to our attention, not because it's a case that we've necessarily known about, but it might be something that a person has visited here and has been identified in Melbourne, a person who's come to our region for a permitted reason. We all usually work very closely with the public health unit that might be looking after that person. But by the time that that's happened, it can happen very quickly. It may well be that those exposure sites are already on the website. So we do ask our community to support the public health unit and all we who in Ballarat work to try and keep our community safe by being quite careful, cautious and vigilant and keeping on looking at those exposure sites to make sure that they haven't been somewhere that that existed. If you do see an exposure site that you've been to, please don't wait to get a text message. If it's a tier 2 site, you will get a text message, but please don't wait until you get the text message before you take the action you know you need to take. If it's a tier 2 site and you've been there, please stop where you are, isolate, seek a test, and only leave isolation once you've returned a negative test. That's a way of us knowing that there hasn't been spread to you from that site from your casual exposure to it. The other important thing to do is to make sure you're using the up-to-date app for QR code checking, because that allows you to easily look back on it and see where you've been. It will actually track your QR movements for you so that you can easily report where you've been also, in case we, in that first interview, if you do become a case in that first interview, we can then find that out and easily start that alert process. So part of responding to our exposures, of course, is that we need people to get tested. And what a tremendous response there's been in Ballarat this past week and a bit. We've had over 15,000 people tested at a number of sites. We've had fantastic support, as we all know, from the state in setting up sites and staffing them, in addition to the sites set up by Ballarat Health Services and the Grampians Public Health Unit. And of course, the other sites, that the other locations for testing that are here routinely at the UFS clinic on Dana Street and the 4-site drive-through on Skipton Road. So we now know that after tonight, there'll be 3 sites available for testing tomorrow, because the Marty Bush drive-through will continue to operate until we no longer need it. So the last thing I'd like to mention is around wastewater detections. As you might recall, it was the wastewater detections which gave us the early warning signs and had us start taking actions for the collective action, actually, as a city we took in order to establish our testing and get ready for response for whatever might come. Having set that testing and having the communication program around that testing, we then started seeing our cases come forward. And it was very important that we continued to monitor wastewater detections, because that gave us some confidence that we were actually matching it with the cases where we knew they were. So the news today is, in fact, that we have 3 new unexplained wastewater detections. Now, this is not necessarily as alarming as it might sound, because it's possible that the primary close contacts who are in quarantine, or other people who might be in quarantine, such as red zone returnees, may well be living in those locations. And as expected, as I've mentioned, it's likely that some of our primary close contacts will become positive in coming days. But if you do live in certain suburbs to the north of Ballarat, and then some other suburbs I'm about to read out, we're very anxious to make sure that you do seek testing, even on the slightest of symptoms, please. Because by having you tested and by seeking that testing, we can exclude that, obviously, if you return a negative test, that it's not you, but also the more people, like with everything, the more people who come out for testing, the more confident we can be around containing the concerns we might have around those wastewater detections. So that people who live in suburbs, particularly Lake Gardens, Alfredton and Delacombe, Redan, and then the suburbs of Ascot, Bald Hills, Ballarat North, Blowhard, Cabbage Tree, Cardigan, Invermay Park, Lake Gardens, Lake Windermere, Learmonth, Miners Rest, Mitchell Park, Mount Rowan, Smoky Town, Springmount, Sulky, Windermere and Windermere. If you live in those suburbs, we're very keen for you to come out and be tested, even with the slightest of symptom, a scratchy throat, a passing headache, feeling a bit off colour. Please come out and get tested. Now that list of suburbs will be on the Ballarat Health Services social media, so that you don't need to scramble to write those down. They also were distributed to our media colleagues in our city earlier today, so hopefully it'll be easy to find those suburbs. So with that, I'll be handing over to Hugh. Thanks very much.
Thanks, Rosemary. And I do want to take just a quick moment to personally thank Rosemary for her leadership, but I'm sure the Ballarat community and the region thanks you and your team for the leadership you've shown, particularly in these really, really challenging times, and the leadership you've shown and representing us to state government as well, when you had that slightest gut feeling or the inkling that things weren't quite right. And it certainly led to Ballarat getting very, very much on the front foot. And I know that we've spoken about it before as well, but the response of the state and getting the state to respond swiftly, and hence we're out of lockdown. We need to still be safe, but just having those shackles taken off a little bit, certainly for our own mental health, is really incredibly important. So thank you to Rosemary and the team. I want to introduce Hugh Varley. Now, Hugh's the Manager of Rapid Response Engagement with the Department of Health, and he will talk to us tonight in relation to the current restrictions that are in place. And he may even just give me a little bit more insight. I'll put him on the spot to talk about what is happening generally in the whole of Victorian scene. Welcome, Hugh, and welcome to Ballarat this evening.
Thank you, Melanie. It's great to be here, and thanks for the invitation, and thanks to Rosemary for giving a very nice situation update locally. So as Melanie said, I'm a manager in the Rapid Response Engagement and Testing team in Melbourne. And I just wanted to say what a terrific effort it has been for everyone who's here tonight and the Ballarat community at large, having worked incredibly hard over the last 7 days in terms of testing and just supporting one another through quite a difficult period. And those of us who are based in Metro Melbourne, we certainly know how difficult it is to be in lockdowns. We've been doing plenty of it lately. I might begin tonight by also acknowledging the traditional owners of the land on which I'm on, which are the Wurundjeri people of the Kulin Nation, and pay my respects to their elders past, present and emerging, and also acknowledge if on this call tonight there are any people who identify as First Nations, and thank them for their efforts in supporting the response in Victoria so far. So maybe I'll begin with a little bit of an update in testing in the Ballarat region. So as of 5:30 tonight, there were over 535 tests done today. And in total, as Rosemary referred to, you've done an incredible effort over the last 7 or 8 days. Some of the figures that have come in over 13,000, so 13,233. So you should be very proud of that effort. And just because lockdown is over doesn't mean that that needs to stop. As Rosemary said, the 2 key focuses going forward is if you develop any symptoms or feel unwell, get tested. And obviously going forward, vaccination is going to be a huge priority. In terms of testing, the busiest day was actually last Friday, the 17th, where there were over 3,000 tests performed, followed up by the day before. As the situation changes and the lockdown ends in Ballarat, it will mean that we're going to plan to withdraw some of the recently added testing capacity from the area. So just to reiterate that the 3 remaining testing sites that are still open are Marty Bush Reserve, Skipton Road, and also UFS on Dana Street. Some sites are closed, even though they might look like they still have infrastructure and equipment on site. So they include the testing site at Victoria Park and also the kind of sports stadium. Now, what I might do is just talk a little around the change in restrictions, and we're really, really pleased and really grateful for people's hard work and effort and patience as you know, you've gone through a difficult week, and it's certainly great to have additional freedom since midnight last night. But we also want to remind people that you need to stay safe from this virus, and that's really important. So Ballarat has moved to the COVID settings where it was under before the lockdown, with no reasons required to leave the home and no limit on travel throughout regional Victoria. It's really important to stay safe, and for that reason, there are still some important public health restrictions that I'm going to talk about a little bit. To begin with, in relation to masks, they still must be worn indoors and outdoors, so no one can come to your home to visit. And as I mentioned, getting tested and vaccinated is just as important as ever. When it comes to travel, you're not permitted to travel to metropolitan Melbourne, and that also includes regional LGAs or local government areas that are currently in lockdown, such as Geelong or the Surf Coast, except for very limited reasons, including authorised work, permitted education, care, compassionate reasons, whether you need to get necessary goods and services or visit an intimate partner. Likewise, the same travel rules apply to people from Metro Melbourne or any other area in lockdown. So as I mentioned, Geelong on the Surf Coast, they cannot come to Ballarat to see you for anything other than the permitted reasons, and businesses are required to check IDs for addresses. Now, Rosemary did mention earlier about the importance of scanning the QR codes. So that's how we identify people who might have attended a site that becomes an exposure site where a potential case might have visited. As Rosemary mentioned, in the Ballarat region at the moment, members of the public are still getting text messages if they're exposed in a tier 2 site. And this really heightens and reminds people of the importance of using your phone to scan in. So please continue to do that. It's a really important piece of keeping yourselves safe and your family safe in the wider community. In terms of catching up with people, you can now catch up with friends and family outdoors, but it has to be in a public place. And unfortunately, a public place doesn't include your backyard. So I really want to emphasize that you cannot have visitors to your home based on the current restrictions. In terms of religious gatherings and ceremonies, that's limited to 20 people at the moment for funerals. So make sure you check in with the latest guidelines and rules with the Service Victoria app. The authorised worker list no longer applies for attending work in Ballarat, but generally the best advice we can give you is if you can work or study from home, you should continue to do so. Offices, in terms of attending, can permit staff to attend on site for work, but there are capacity limits. Childcare and kinder are open, as is outdoor community sports for training. Gyms are open with strict limits. And I think my colleague John, who's on the call tonight as well, is going to put some links in the chat, and I'm happy to take questions at the end. Thank you.
Thanks so very much, Hugh. And we're certainly very, very proud of our community and their response. But we also, once again, thank you for providing capacity and staff to deal with the enormous effort that was needed to deal with the testing. It's been a wonderful response, and it certainly felt like when we put up the call out, the cavalry arrived, and we knew that our community would step up very quickly, and the state government stepped up very, very quickly to match that of the community. So thank you. Next, we'll hear from Evan King. Evan spoke last week as well. He has been out and about, and we've been in many, many meetings, and no doubt he's a little bit weary, but has represented this community incredibly well. Evan's a CEO of the City of Ballarat and has been an incredible advocate for the community, and certainly been putting everything forward he possibly can, not just for the health relief required or the health impact of this virus in our community, but more importantly as well, of what is available to provide relief, socially and also economically to our community. So welcome, Evan.
Thank you, Melanie, for that introduction, and thank you to Rosemary and Hugh for your sessions tonight. Can I thank Rosemary, although Rosemary has obviously been quite visible over the last 7 days. This has been a very long, I suppose, project that Rosemary's been working on for a very long time, and particularly through our health protection working group, Rosemary's played an incredibly important part in that. Can also just thank Melanie for the work she's done. Just an incredible job. The collaboration, the genuine care. I know you've worked 7 days a week, 24 hours a day. You know, that has a huge impact on you and your family. But I do genuinely, from the city of Ballarat, from our community, thank you for what you've done. It truly has been a really exceptional demonstration of your skills and your leadership. You know, we're in a really interesting space at the moment. You know, restrictions have been eased, but we still have virus in the city, and we really need to be incredibly vigilant. You know, we do need to thank everyone for what they did. You know, a 7-day lockdown is unheard of. You know, and that is really a direct response to the great work of a whole range of agencies and our community, and we want to keep it that way. You know, it isn't. You know, it is incredibly challenging for our businesses, for our community, for our mental health. We really want to try and, you know, continue to reduce restrictions, but it is really on us to make sure that we're incredibly vigilant as we go forward. So, you know, I do want to thank the Ballarat Health Services, the Grampians Public Health Unit, the Department of Health, the Health Protection Working Group, the Grampians Area of Operations Control Team, the Department of Jobs, Precincts and Regions, our incredible welfare agencies that every time there's an emergency just jump to attention and do what needs to be done to protect our community. I especially want to thank the staff of the City of Ballarat. I know many of you have worked incredible hours to protect our community. I want to thank the rapid response testing team. You know, above 13,000 tests within the space of a week is incredible. To build the infrastructure, to get the testers in, all the infrastructure and you know, work that needs to be done to make that happen was just incredible, and I think we need to acknowledge it. But the biggest thanks goes to our community. You know, I was up at the Victoria Park testing site, and you know, I saw carloads of families sitting there for 4 and 5 hours. You know, it can't be easy. It's hard enough being locked in a house with your family, let alone a car for 4 or 5 hours. You know, and the community did that. And why did they do that? Because they wanted to protect one another. And I think it's really important to acknowledge that this is, you know, a great outcome for the community, but the emergency isn't over, and we need to continue to protect one another. From a relief perspective, you know, the COVID hotline is the best line for anyone to ring. So please, 1800 675 398. Should you need any relief of any sort, please ring that number. It will go to the Red Cross, and then the Red Cross will triage that to wherever it might go. So whether it's meals, whether it's accommodation, whether it's any particular needs you have while you're in isolation, we can work through that and we can determine who is the best agency to provide that support. The City of Ballarat continues to offer community and business grants to those small businesses and our community groups. We know it's incredibly challenging. You're not being able to do what you normally do, and we want to be there and be part of the support. Obviously, with the roadmap out of this, vaccination becomes incredibly important. And the City of Ballarat has a vaccination tracker on our website, so you can log on there and you can see where our vaccination rates are at. So for all of those people 15 and over, we've got 76.8% of our community with their first dose. That's great, but we need to keep working on it. For 15s and over fully vaccinated, we're at 50%, and we need to continue to work on that. So please ring up, make an appointment, and get vaccinated. That is our pathway out of this. So there's some key messages. Get tested, isolate, please use your QR codes, because that is so important when we have an exposure site. that you can check yourself. You can look at your log, look at where you've been, what time you've been there, make sure it's the most up-to-date app on your phone so that it's working properly, and get vaccinated, and please stay vigilant and look after yourself.
Thanks, Evan. I think some really critical messages there, and timely reminder also of the support that's open to yourself personally, but also to our businesses that are an incredible part of our community. So thank you. Unfortunately, Karen Heap tonight, Karen is the CEO of Ballarat, has been unable to join us, and she was incredibly disappointed that another issue has come up that she needs to deal with. But what we'll do is we'll continue to liaise with Karen, and she will provide Aboriginal information support through BHS so that we can actually give that information to the community. So apologies for that, but we'll continue to get that information provided to you. Next, I want to introduce Nikki. Nikki Staffel is a disability liaison officer with the Ballarat Health Services, and I want Nikki's going to provide some information in relation to the local disability support services that exist in our community. Thanks, Nikki.
Hi, thanks, Melanie. Thank you for having me tonight. I did want to introduce myself and my role. I won't take up too much time, but because I know there's a few questions related to some other areas, but my role is the Disability Liaison Officer based at Ballarat Health Services and covering the Grampians region. Myself and a team of 2 others are employed through Ballarat Health Services, but we do cover for the whole Grampians region, and we're looking at improving access for people with disabilities, particularly in the COVID-19 testing, treatment, and vaccination space. So our role is to address the barriers that prevent people with a disability from accessing services, whether that's fear, uncertainty, or issues with accessibility. In addition to supporting people with assessment and treatment, we also support people with disability to access non-COVID-19 services, which may have been impeded by the current pandemic. And I think that's really important to recognize. So we can do some community outreach. We can liaise over the phone. Most recently, we've been focusing on vaccination and access to vaccination. I know in the last community forum, it was questioned about people with disabilities not being able to leave their home to receive a vaccination. And we do have some wonderful resources with the Department of Health and Aspen to work together to put people's names on a list to have the option for in-home vaccination. If that's not the case and they still do want to come to the vaccination clinic, that's absolutely an option for us as well. And we will work with people on whether or not there's barriers to transport and getting into the Mercure for a vaccination. I don't have necessarily information about disability support services in the community. There are lots of them, but we do work with people with a disability, whether or not you have an NDIS package. It's not relevant. It's just if there is a barrier related to access and you have a disability, we are more than willing to help. Our contact information is on the website. There is a central email. We do get referrals from the call center in Melbourne as well, and we get those on an almost daily basis for people who are accessing information. We do also engage in a few outreach activities in the community and have assisted with Ballarat Community Health and McCallum Disability Services to actually run some vaccination hubs offsite for people with disabilities. So it's been a really great project that we've been working on with those 2 organizations and quite a few other local organizations that are involved in some steering committee activities. So our email's open. I believe my number's on the website as well as my colleague in Stall. And yeah, we look forward to supporting you in your journey here.
Thanks, Nikki. That's wonderful information to get out to our community. And thank you for all the work that you do. It's wonderful to see we've got some wonderful questions coming through. And so my role is to now facilitate the Q&A session. What I will do is ask the question. I will then point it or deliver it to a person that I think may be best positioned to answer that, but also feel free to jump in to provide any further information on those questions. So Hugh, the first one to you. If we're fully vaccinated, do we still need to wear a mask?
Thanks, Melanie. And listen, it's a really good question and a very valid one that we receive quite a lot. The reason we encourage people still to wear a mask is because when you get your 2-dose vaccination, you're fully vaccinated, you can still pick up the virus. And that's important to remember. Now, vaccination is incredibly effective at stopping people from getting sick and stopping people from ending up in hospital and preventing people from needing intensive care. However, our understanding based on the evidence that we have at the moment is that people can still pick up COVID-19, especially this Delta variant, when they're still vaccinated. So that's why it's really important to wear a mask to protect yourself, to protect your family, to protect your friends, and the wider community. So as I talked a little bit about earlier, the restrictions at the moment that have come into place from midnight last night still indicate that when you're outside or inside, you should still wear a mask.
Thanks, Hugh. The next one, Rosemary, we know that you've become quite the expert on wastewater detection. So a wastewater detection question for yourself. So if my suburb isn't listed as a wastewater detection location, does that mean I don't need to be worried?
Two things about wastewater detection. One is it's very sensitive to tell us that there might be COVID, but it is only, it doesn't necessarily pick up everything. Otherwise, we would have wastewater detections across Melbourne all of the time. So it can be quite nuanced in what it picks up. So, and there are other reasons why we need to be worried apart from what happens in the wastewater. And they are that, as Evan has said, it's possible that we still have COVID circulating in our community. And it may be that it's circulating in a way that's confined to people who are in quarantine at the moment, but it may not be also. So it's important, again, the most important information we can be saying is that even in the slightest of symptom, a sniffle, a headache, a scratchy throat, feeling off colour, we really ask people, especially at this time where we know we've had COVID in Ballarat, to come out and get tested. So as you know, we've had wastewater detections in every part of Ballarat over the past week and a half. And so, and indeed it was only a couple of wastewater detections in one part of Ballarat which alerted us in the first place, that told us we needed to start taking some action to get ready for something that was coming. And that will continue. Wastewater can come from one of two sources, either somebody who's got COVID and is continuing to shed and excrete some COVID particles, or indeed from someone who's newly infected before we even know, and sometimes before they even know they're infected. So just because your suburb isn't listed today, that doesn't mean there hasn't been some detections and ongoing continuing detections in those other places. These were new detections from today that I'm talking about, which are still subject to the same confirmatory processes. They're always double checked. But given that we're in a time of COVID in Ballarat, there's no reason to suggest that these won't be confirmed, just like all the others have been.
Thanks, Rosemary. The next question I'm going to go back to Hugh on. How often should you get tested if you have a negative result but persistent symptoms?
Yeah, that's also a great question. And listen, I think Rosemary might be able to back me up on this a little bit, but it's super, super important, even if you return a negative test, if your symptoms continue, and for different people, it's going to be different timelines, but certainly if there are 7 days between your test and you're still having any sort of symptoms, you should get a repeat test. And it's really important that you do so. The way this virus works is for different people, it can show symptoms quickly, or it can take a little longer for different people. There's not an exact number, because just like the color of everyone's hair, we all have different color hair. So for everybody, there's a slightly different, what we call an incubation period. So for that reason, any symptoms, really think about getting tested. It's really important.
Rosemary, do you have anything to add to Hugh's comments on that one?
I'd probably narrow that interval a bit, probably bring it down to more than 4 days, because we know that, for example, if someone's tested negative and has symptoms, they may be lulled into thinking it is just hay fever, and it may go on for a whole week. And because they think it's hay fever, they haven't necessarily been isolating at home like we asked them to do. And then they get tested again and suddenly it's COVID, and we realise that in fact those symptoms from 6 days ago were COVID, or we have to think that through. It becomes quite complex. So I'd narrow that down. But what I would say is that if anybody has symptoms, we need them to stay home. And if a person thinks it's hay fever, then we ask them to take their usual medication that they might be on, some antihistamines or some nasal spray, And if their symptoms aren't relieved in an hour, then they should seek testing and assume that it's at least seek to exclude COVID, because we want to make sure that a person isn't thinking it's something else when in fact it could be COVID also. COVID actually has lots of different shapes and pictures. And so I think that's why we have such a broad range of symptoms that we ask people to consider, and to at the slightest of inclination to go and get tested.
What are some of those symptoms? I mean, Rosemary, you mentioned, the scratchy throat, or the persistent cough, or that, the headache, or just not quite feeling yourself. And there's a broad range of symptoms. What are some of the other symptoms that people should just look out for?
Well, a runny nose, a cough, a headache, losing the sense of smell or taste, and indeed sometimes abdominal pain might be the only sign of COVID. So that's why in an environment like ours, where we have 3 options for testing now, we're hoping that people will come out and apply that self-care also to exclude the fact that it might be COVID. So there is a broad range. Look, there are some things that COVID's not, but I'm kind of inclined not to mention those here, because we know that it can be quite a confusing picture, and the best thing is just to get a test and exclude COVID.
Back to you, Hugh. We're very much on the health scene, but is there 100% guarantee that the vaccination won't stop someone from falling pregnant? The doctor could not guarantee this. What are your thoughts?
I'm sorry, Melanie, I actually am qualified to answer that question. So that would be probably, you would need to chat to your GP, I think would be the best advice, because I think everyone's situation is different. I will say that there is a growing body of evidence, both in Australia and throughout the world, that when you're pregnant, it's still very safe and it's very important to get your vaccination, because the other aspect of it is if you're pregnant and you get COVID-19, it can be really, very, very serious.
Rosemary, do you want to provide any further advice?
Yeah. To my knowledge, we have no evidence that COVID will prevent a person from later pregnancy. And I can only reinforce what Hugh has said. We know that there are millions of women who've had COVID vaccination safely and have had a very safe experience for themselves and their babies. And yet we also know there are millions of women who've had COVID while pregnant. And even in Australia, we know that there have been women who've ended up incredibly unwell, and tragically, their babies have also been very unwell. And as we know, there's increasing COVID among us. In Melbourne, in Ballarat recently, as people move between the two for permitted reasons, as I've said, someone can bring COVID unknowingly exposed, unknowingly infected. So that's why vaccination is our best defence. And there's an enormous amount of evidence now that vaccination in pregnancy is very safe, and the benefits of being vaccinated in pregnancy just, far outweigh the terrible consequences of what can happen if a person is pregnant and then gets COVID.
Thanks, Rosemary. Next question is to yourself again, Rosemary. How long does it take for a site to be classified and people notified?
That's a really good question, and it really depends on the quality of the information we get from somebody who has visited the site who is a case. So, for example, if someone has done their QR code and checking in, then they can give us the information in that first conversation we have with them about where they've been. And we also can, as we know, if a person has been doing their check-in, when we're notified of the case, we'll also get the information from the central intelligence of the Department of Health as to whatever information they may have linked to those locations where they've checked in. So that permits the local contact tracing team to start working on that straight away, notifying the site. Look, if it's at 2 o'clock on a Sunday morning, it's not going to happen at 2 o'clock on a Sunday morning, but I know that I and my team have been working late into the evenings in order to be notifying, especially in food distribution centres where, in fact, the purveyors and proprietors want to know late, because then they can enact their cleaning mechanisms to then potentially open up and be ready for business in just 12 hours' time. So there is a time urgency around it. So that's one thing. Once we know about the sites, because we've been able to get that information from the case, then we can start acting on it. The second thing is that in acting on it, we send that information centrally, and that triggers a couple of processes. The first is that it allows that information to be put up on the website, and it should trigger that text message that should come. But as you would appreciate, there are now thousands of exposure sites, so there might be a time delay with that. And there may not be either, but what I am wanting to make sure is that people appreciate that our system, and we are working 7 days a week and very hard to make sure this happens in a very timely way. But it's important that people take notice of information around them. And if someone thinks they've been to an exposure site, just stay put and leave only to get a test, and then go about your business when you return to negative test. And can I just take the opportunity here to thank the public health unit team. We started. We've only been in existence for this year, and we did a lot of work in the COVID case response in Ballarat last year. We've been working on, as Evan said, as a city, we've been working to prepare for exactly these kinds of eventualities, which we've confronted and faced ongoingly, and that's in association with the City of Ballarat and others of the health agencies and other service agencies in Victoria, in Ballarat. But earlier this year, the Grampians Public Health Unit was established, and we've assembled a fantastic, small but dedicated and very committed squad of experts, especially in the contact tracing, testing and vaccination space. So I'd like to acknowledge our Director of Operations, Robin Wilson, who hasn't been on these meetings, but many of us will know her. She has been a public face also of the vaccination program. And the team we have, our team leaders, our contact tracers, our administrative staff, none of this could have happened in the way it had happened if it wasn't for the dedication of the Grampians Public Health Unit team in partnership, absolutely in partnership with all of the other agencies we've worked very closely with. So I'm just giving a plug to the team. I hope that's all right. Thanks.
Thanks, Rosemary. I do have quite a few questions in relation to exposure sites that I'm going to get to, but Evan, the question in relation to assistance, if my hours are cut in hospitality because hours have been reduced with only 10 people allowed inside and we're no longer in lockdown, is there any assistance available?
Yeah, look, thanks, Melanie, for that question. And we do need to acknowledge the massive impact of 18 months of in and out of lockdowns on our hospitality industry. The City of Ballarat is working really closely with Commerce Ballarat and the hospitality industry to look at ways that we can try and increase the footprints of those businesses, and particularly outside as we work through the roadmap. If your hours have been reduced, I strongly recommend you go down to Centrelink and find out what support is available. Everyone's circumstances are a little different in the end, so it's very difficult to give exact advice to individuals without knowing the full picture. But I just recommend go down to Centrelink and find out what's available. But no, we are working very closely with the hospitality industry to really help them reinvigorate when restrictions allow.
Thanks, Evan. Back to exposure sites, Rosemary. What is going on with the Newington Primary School? We have no new information.
Okay, so the Newington Primary School, some members of the school community tested positive to COVID, but it was the determination of the Public Health Unit using the conventions we have in the Department of Health around determining infectiousness and a period of infectiousness around a case, that those school community members were not present on the school during the period of their infectious period. So accordingly, given that school then had broken up on holidays, no action was taken by the Public Health Unit. And we learned yesterday that some action had been taken by the Department of Education. We've now worked with the school to resolve that. And to my knowledge, some information was going to be sent to the school, or the school was going to inform the school community of that determination.
Thanks, Rosemary. Another exposure site. Can you explain the GovHub exposure sites better, please?
Okay. I appreciate this is a complex because there's three different sorts of things that we're dealing with here. First of all, as we know, GovHub became an exposure site earlier this week. And then with more information, we did need to expand the location of and the nature of the site. So very simply, the GovHub can be thought of as two different components to it. So there's the part of the GovHub where staff, visitors and contractors work. And that's not public facing, and people can only go into those premises, I gather, because they are staff or visitors and contractors and permitted to do so. Because we know that we had a positive case who was in that area between 7 a.m. and 5:10 p.m. between Monday and Friday last week, that site between those hours became a tier 1 site because we know that person moved through that area and we were unable to identify any particular area where they didn't go. Outside those hours, even in that non-public facing area, if there was anybody on those premises outside those hours and not at any time inside those hours, then those people would be classified as tier 2 contacts. The Vic Roads Service Centre, which is the public facing side of the GovHub, is a tier 2 centre. So that means by tier 2, we mean that people who might have attended during those hours last week, we ask to stay where they are, get tested, and can go about their business, their daily lives once they've returned a negative test. So essentially, we've got part of it is a tier 1 site, but that affects staff, visitors, and contractors only to that staff area. Then the rest of it, and that's only for a period of time between Monday and Friday last week. And everybody else who might have been on the GovHub at sites at times outside those working hours, Monday to Friday, in that staff area is classified as a tier 2.
Thanks, Rosemary. I hope that clears it up. I know that we've tried to explain that situation many, many times, and it is quite complicated with the different interactions of both the public and staff at that site. A question for you, Hugh. Why aren't rapid antigen tests available to purchase by the general public? Wouldn't it be better to rest at home with one of those and then go to a centre if you're positive?
Yeah, listen, that's another really good question, and I think it's something that's very topical at the moment. What I will say is, based on studies and evidence that we have in Australia and from internationally, we definitely understand that these rapid antigen tests aren't as accurate as the common test that we call the PCR test. So for that reason, at the moment, the government is looking at whether and how we would bring in a rapid antigen test to support what we're already doing. In the event that we start using them, and there's a group in Australia called the TGA, and they actually have approved a number of these items, but at the moment, based in Victoria and other jurisdictions, the legislation and the policy hasn't quite caught up. So I know what I will say is government are definitely looking at this really carefully. And because we've got increased COVID in our community and more community transmission, it is something that we might see in the future, but not right now.
Nikki, how do people who are unable to leave home due to a medical condition get a vaccination?
That's a great question. Even though it's not classed, a medical condition is not classed as a disability, we are looking at accessibility as a whole. So if you are having issues with accessing a vaccine because of not being able to leave your home due to a medical condition, we can arrange for you to be put on the list for Aspen to do in-home vaccination. And that will hopefully be able to bypass that issue. But then we also, if people are able to leave their home too, I just want to flag that we've had some really great work done by the nurses at the Mercure who have offered to come out to cars. And I just want to highlight that because it's really important for those people who might not be able to go into a really high stimulus environment or might feel that walking from the car into the hub is too tiresome because of a medical condition. So if you can get to the Mercure, we'll try to work with you to get there. But if you can't, then we'll definitely put you on the list for Aspen.
Thanks, Nikki. And they're best once again to either go through the 1-800 number or yourself directly?
Yes, yeah. So either my email, which is on the website, or through the 1-800 number, they will put you through to ourselves.
Fantastic. Thanks, Nikki. Now, I'm going to read this out verbatim, Rosemary, so one for you. So can you give some clarification around times provided for exposure sites? For example, Big W was a tier 1 from 4:45. A friend checked in at 4:27 and then checked in at another location at 4:39. However, has been forced to isolate for 14 days. Is the listed time not the earliest exposure time? Sounds a bit like a riddle to me, but so is the listed time not the earliest exposure time?
Thanks very much, Mel. So again, there are two situations in which we'll list a site. One is where we know a person has checked in, so we have precise information about when they've checked in and arrived. But others are where people tell us that they went there, they think. And so, they're confident they went there, but they can't quite remember the time. They think it was about a certain time. So what we do with the latter is that we have a buffer about a half an hour in either direction of when they thought they arrived and when they thought they left. The half an hour beforehand is to capture those occasions when we think a person may have been there, but they might have been earlier, and it's quite crucial not to miss that earlier time. And the reason we have a half hour buffer afterwards is in case they're later than they thought, that's one thing, but also because we know that aerosols can remain in the area for about a half an hour after a person has visited, especially an enclosed space. So that's why all of our indoor exposure sites will have that extra half hour added at the end. Even if we're confident that a person has left at 5 o'clock, we'll still add it and place it till 5:30 in case there has been that aerosol and it's remaining in the environment.
Thanks, Rosemary. That's a great explanation of a very complicated question. One for Hugh. Is the dose of vaccines the same dose for both adults and children?
It's actually one that I'm not 100% sure of. Yeah, I don't know if there's anyone else in the panel here who'd know that. I think I'd have to double check that before answering it.
Rosemary, did you have a comment on that one? We will find that out and certainly provide that answer. I think it's a very, very good question as I head to get my children vaccinated this Saturday. So if a mother is fully vaccinated and breastfeeding, does the child gain the antibodies? I'll throw that one to Rosemary again.
One of the reasons that we actually recommend a pregnant woman be vaccinated is because it does confer some passive immunity on the baby. I'm unsure of the evidence around breastfeeding, but we do know with other vaccines that that's certainly what we call passive immunity. And so it is something that does happen in vaccines. I'm unsure of the precise evidence around COVID, but there's no harm from breastfeeding after you've had your COVID test, your COVID vaccination.
Okay. To Nikki, there are many disability services in Ballarat and many clients who may have a number of workers. How is the information conveyed to these clients? And is there an outreach program where healthcare workers go directly to clients rather than information being passed down from the employer to the worker and then to the client?
That's a good question. I was looking at that and wondering if that was in reference to COVID exposure or if that was in reference to understanding about the disability services as a whole. So I can answer kind of in two parts. We do understand that there are quite complex systems within the disability sector. So we are currently working with the public health unit to ensure that we're aware of all of the disability providers in the region. And that extends all the way to the border of the Grampians region to ensure that if there is an exposure within one disability house or a day program or at another service provider, that we're able to convey that information quickly and rapidly to all of those people that are involved with that client, but also who they might also have come into contact with. If you're referring, if the question's also referring to people knowing information about the disability liaison service and through about being able to access vaccination and COVID testing, we do have a number of networks, and the Department of Health is responsible for advertising our roles across the state because we are a statewide service. I believe there's upwards of 32 DLOs across the state at the moment. So we are working on trying to build exposure to the role and promote the role in various different ways, such as tonight, but also through the NDS, through the NDIA, the NDS, all of the acronyms that are involved, just to make sure that everybody does have information. We would hope to be able to do an information session at Ballarat Health in the future to alert people to our service and maybe get some feedback on where areas we can improve. But at the moment with COVID and restrictions, we're not able to do so. But if you have any specific questions about disability services in the region or anything related to health and access to health for a person with a disability, please just email or call me. I'll be happy to help.
Thanks, Nikki. Okay, I think the next one is the one that's on the tip of everyone's tongue, and Rosemary or Hugh or Evan, happy for anyone to answer this one. But is there a chance of us going back down into lockdown soon?
I'm happy, Melanie, to start that one off, and I'll let the health professionals finish it off in the end. There absolutely is a chance, and it's a risk that the city is in at the moment. The continued detections in the wastewater would suggest either someone is still shedding the virus or has the virus and we don't know about it. The most important thing is, how do we prevent the city going back down into lockdown? And that is, if you have any symptoms, go and get tested. If you go anywhere, make sure you're using your QR codes, make sure you're isolating. That will prevent us from going into lockdown. None of us have a crystal ball that can tell us whether we will or won't, but we can do everything possible to try and prevent it. And that is actually in our hands, and that is something that we do control ourselves.
I don't know whether there's anything anyone wants to add to that answer. I think you're absolutely spot on. But, unfortunately at this time, until we get those higher vaccination rates up, there is a potential that we could go back down into a lockdown situation, something that we want to avoid at all costs. Rosemary or Hugh, did you want to add?
Can I add that at this stage, when we still have double vaccination around the 50% mark, lockdown is a tool that's used when there's a belief formed by the Chief Health Officer that there's a risk of uncontrolled undetected spread in a locality. So that's possible in regional Victoria, particularly where we can ring fence localities, just like we've done in Ballarat. And once the Chief Health Officer is of the view that is the COVID is both apparent and explained and controlled, then that's the end of lockdown. And I think, Evan, you said that there hadn't been a 7-day lockdown before. To our knowledge, we think we're possibly the first city in Victoria, the first location in Victoria where it said a short, sharp lockdown actually was a short, sharp lockdown. Now, that's something to be very thankful to the whole community for, but we're not there yet. We're not out of the woods. In time, as we have more people vaccinated, the impact of having undetected, unexpected COVIDs in the community is lessened, and the risk of that impact is lessened in terms of what that can do to others who are vulnerable and may become exposed or unwell. So there's a titration. What I think we've done by going into lockdown and by getting on top of this particular run of cases is we've bought time for our community to increase our vaccination levels. And if we do that by 5% a week or so, then just in 4 short weeks, which is indeed what happened in the last week, we went up by more than 5% on those first doses, and similarly on the second doses. If we can do that over the next 4 weeks, then we'll get to that 70% mark, and then just a couple of weeks later, we'll get to the 80% mark. And we know that the virus will behave differently once we have that level of immunity in our community. So that's what we're trying to do as a community. We're trying to buy time, because there are some people who haven't been able to access vaccine, or indeed, as with other vaccines, even if they've had vaccine, they may still be more vulnerable, as Hugh said, to having the effects of COVID if they do acquire it. So we need to be protecting our whole community and to be sharing that load, and for our whole community and for the sake of our community, working to buy that time by staying safe, to make sure that if this happens again, we've just got that extra level of immunity across our community to then prevent that further levels of illness and severe illness if in fact this gets out of hand.
Thanks, Rosemary. The second half of that question is, how will we be protected from our hospitals being overrun before we reach higher vaccination rates? And I'm certainly happy to answer that question. And we know that Ballarat Health Services is set up. We are prepared for an outbreak of COVID in our community. So we're well prepared, we're well practiced. We have the most incredible teams and clinicians and also the infrastructure to support should we have a COVID outbreak. I say that as well, though, with a level of trepidation. We can't do this alone. Even in Ballarat, we would rely on the partnership with St John of God and the other hospitals as well to provide support. We would need to clear out, for example, our ICU, and St John of God provide us with support to do that, to look after those patients in our care at the moment that require care that are non-COVID patients. So it is a whole of system response. We are certainly not in this alone. And I think we've certainly seen that in the last week or so when we had a situation that even our testing facilities couldn't cope with. We then had to rely on other services. And it's not just, once again, Ballarat, it's a statewide system as well. And we have a whole range of support mechanisms around us, but absolutely, confident that the Ballarat Health Service the hospital can provide the provision for care of our community at the moment should we have an outbreak of COVID-19. Just scrolling down, next question. If an exposure time is 4 p.m. to 6 p.m, wouldn't the true exposure time be 4 p.m. until the shop is completely cleaned? Rosemary, that's another kind of tricky question, but
that is a good question. That's a really good question. And it would depend on, as I said, we do try and get those cleaned and the deep cleans as they need. But we're particularly worried about the aerosols in that shop. And we believe that the half-hour buffer helps with that. Certainly, there's potential for surfaces to have been touched in a shop, but we have found very, very rare occasions where there has been a surface level transmission of COVID. So whereas we have found occasions when the aerosol transmission is something that, as we all heard of, is much more worrying. And so that's why that's the way we do it. We still, once we know that, we still ask the shop to get deep cleaned. In fact, we asked the shop to get deep cleaned even if it was 4 days ago that we found out about the exposure, because there's still value in doing that. But and of course, we would have followed up on all of the people who might have used it. So, but having said that, that exposure time, if it is a shop and if it's considered a tier 2 and we have that, then that's really a casual contact in any case. So it means that we're not particularly worried about the shop because perhaps the person was only there for a short while or something along those lines. It's a good question, and it's sometimes the logic of it is a little hard to understand, but in a shop, we're most worried about the aerosol and the risk of aerosol transmission.
Thanks, Rosemary. And I'm conscious of the time. I think we've covered an incredible array of questions and information that's been provided. And certainly, I thank Evan, I thank Rosemary, Nikki and Hugh for coming along tonight. Our incredible Auslan interpreters, I'm just fascinated in watching them in the background. Kieran and Cindy, a huge, huge thank you to both of you for providing such valuable information. It's incredible. We're absolutely delighted to have you here this evening. To the Ballarat community, as we continually say, it wasn't the actions of the City of Ballarat or the Grampians Public Health Unit or Ballarat Health that has released us from lockdown. It is every action that you took in getting tested and getting vaccinated that has put us in this very, very positive position where we're confident at this stage that we have ring-fenced or contained the outbreak that we're currently dealing with. In saying that, I also say, please, this weekend in particular, be very, very aware, be very conscious of the actions that you're taking, and please stay COVID safe. We will continue to answer questions online. We'll continue to prioritise providing as much information to the community as we can. But most importantly, thank you, and certainly stay safe over the next coming weeks, the next few days, and also, spend a delightful, long weekend with your family and loved ones, and certainly remotely connect with everyone. Your mental health is incredibly important as well in these challenging times. Thanks for joining us. Thank you.